Today I would be sharing with you the activities those we've undertaken in the recent past in the domain of healthcare informatics.
हाँ जी, सर की ऑब्जर्वेशन दो ही थी इसमें कि सर की दो ऑब्जर्वेशन थी इसके अंदर.
उनकी आवाज आ रही है? Well, sir, as far as the contents of this presentation are concerned, we'll be talking about the products developed here at the Healthcare Informatics Division in DAC Mohali, and then we'll talk about the training activities in the domain of healthcare IT, and of course the international collaborations we are in, and followed by the recognitions or the awards that our developments have attracted. इससे आगे नेक्स्ट. हाँ जी, दिल ले जा. Well, sir, very recently we have embarked on a project titled Personal Health Records Management System, which has been christened as My Health Record by the Government of India, that is the Ministry of Health and Family Welfare. In this particular project, we are working on the development of personal health record locker for the Government of India, wherein the facility of recording or saving health records by every citizen of India would be enabled through this system. And then within this system, we have a provision of recording allergies, immunizations, laboratory tests, and other health conditions. And this personal health record management system, as it is, will be fully controlled by the citizen and would be accessible over internet and smartphones. The key inclusions in this particular system are that it enables the citizens to save prescriptions, lab tests, and medical procedures they've undergone. It also includes an intuitive dashboard which gives an idea about the person's wellness parameters, the reports he or she has added, and also the PHRMS or My Health Record enables the printable reports. And very unique feature that we have included in this particular personal health record management system is that it enables teleconsultation with the doctors or the medical contacts of an individual, ugly slide, of the individual, and also enables the sharing of records with family and friends. Based on these suggestions from various experts in the domain, a feature of audit trail has also been incorporated into PHRMS, wherein an individual, whatever changes or whatever additions he or she carries out in the PHRMS, it's sort of logged for every action that is done with the PHRMS system in his or her profile. And besides that, quite on the pattern of the smartphones or the health or wellness apps, those are available in the smartphones like fitness activity trackers or health trackers. We have a provision wherein the parameters recorded by various apps like we can say S Health of Samsung, Apple Health of iOS based phones. These recordings or the data from these apps can easily be imported into, or rather received into the PHRMS, and the person's profile would then be able to archive all the information that his or her smartphone is also recording based on the wellness activities. And these activities include walking, running, swimming, and cycling, etc. Next slide. The architecture of PHRMS is based on various aspects. The users include doctors and the citizens. For citizens, the login would be dependent on the inputs that they provide at the time of registration, and the uniqueness of every citizen's profile or login would be either his mobile number or his or her email address, and also the social security number, that is called Aadhaar number. The user can log into this system through any of these inputs, which are quite unique to every user. And the PHR components, those have been designed in the entire system. They include the basic profile of an individual. It also includes the registrations, the allergies, immunizations, health conditions, medication, lab results, surgeries undergone, and then prescriptions, documents, medical contacts, reports, and standardization aspects as well. And these all modules can receive or send inputs to various systems, or can also receive data from other systems, quite like hospitals, laboratories, or clinical labs, and then various health apps which are installed in various smartphones, fitness trackers, or wearable sensors. We are working on integrating certain wearable devices with this system, and at the back end we have a proper system to enable the users who are using this system, as well as managing the entire system with the help of user management module. A security module takes care of the authentication and access control. And then as far as standardization is concerned, we have inbuilt into it the SNOMED CT nomenclature. Then as far as medication is concerned, we are yet using the RX norms, and the entire system complies with the EHR guidelines issued by the Ministry of Health and Family Welfare. And also the system is capable of sending alerts to the users depending upon the activities that the user is performing, or the input that is being received in the user's profile from various sources. Next slide. And as far as PHRMS users are concerned, as a PHR, the system to an average user enables the recording of prescriptions, lab test results, sharing with doctors, printable reports, and a recording of wellness activities. As far as doctors are concerned, this PHRMS has an inbuilt, or I would say a back-to-back connectivity with a clinical practice management module, which will enable the doctors to source data of various patients who are having the profiles, or who are having the data stored in personal health records. So this PHRMS also has a clinical practice management module, which enables the doctors to manage their practice. It is back-to-back integrated with PHR, wherein the doctor can, whatever the doctor has recorded for a patient in the e-prescription format, that gets stored in the patient's profile, and at the same time any inputs those are stored in the patient's profile can be retrieved from the profile. The doctor would also have a comprehensive dashboard indicating to him or her the number of cases those are lined up for the day, the cases those he's done, and the ailments on which various patients have been treated. And also it also has an appointment scheduler and enables the doctors to print reports. As far as health administrators are concerned, we also are working on development of administrative panel, which would present to the administrators and the policymakers a complete set of statistics of the usage of PHRMS, and would also provide interactive visualizations on the comprehensive dashboard that we are working on, and would also enable public health experts to see or have a look at the trends of various ailments or various illnesses those are affecting a certain sector of population. This PHRMS, as we've just talked about, is already complying with the standards, namely EHR guidelines of Government of India, then RX norms and SNOMED CT. We've also integrated other services like Mobile Seva of Government of India, then Aadhaar, that is a unique identification identification number that has been provided to every citizen here in India, that has also been integrated into it. Then the Government of India has also set up a DigiLocker, which enables the storage of digital certificates and other documents online. So PHRMS is also integrated for a duplex interaction or exchange between the DigiLocker and PHRMS. Any document from within PHRMS can be pushed into the DigiLocker, and DigiLocker, any document or certificates saved in DigiLocker can be pulled into the PHRMS. And that is what the entire project is, or entire product is shaping up. And Dr. Mishra has been guiding us very closely, and it is partly his vision that we have come up with this kind of a big utility, which is planned to be rolled out very soon by the Government of India at the national level. The second product that we've developed here at DAC Mohali in the Healthcare Informatics Division is the flagship telemedicine solution, which has been implemented at numerous locations in India and overseas. And this is unarguably the oldest telemedicine solution that has been developed by Government of India, and was developed way back in 1998, and since then it has been evolving. And today we have a eSanjeevani, which is a comprehensive telemedicine solution, and the key features include it is very low cost, it is built around indigenous and low cost technologies, and it is an integrated model of telemedicine system wherein all these specialties can use the same system, and it is interfaced with various medical peripherals like ECG, then the medical film scanners, the video microscopes, and other diagnostic devices. It is cloud enabled and also provides the healthcare administrators to have a look at the kind of consultations those are being managed through eSanjeevani. As far as a telemedicine setup that uses, eSanjeevani is used on both the ends, the patient end as well as the expert end. In telemedicine setup at a patient end, we have the depiction or the schematic of a typical telemedicine setup on the patient end includes a patient bed for ECG, etc., and then it has a computer, a UPS, and printer. And along with all these IT infra, we also have various medical peripherals, those we've just listed out. And these particular telemedicine setups have been implemented at around 120 locations within India and outside the country as well. 81 of those are in the country, in India, and 35 are overseas. And since then, 3 of these, or rather, I would say, 2 of these states in the northern India, that is Himachal Pradesh and Punjab, they were rather fortunate to have statewide telemedicine networks. Those were implemented through the implementation of eSanjeevani, and the experiences in Punjab in particular have been really very useful, and have enabled the other states also to learn from their experiences. As far as telemedicine implementations overseas are concerned, we have close to around 39 sites rather, and we have implementations in most recent implementation has been in Kyrgyzstan, and then before that we've done it in Armenia, Myanmar, Tanzania, and there are a couple of other projects where those are in the conceptualization phase, and we are working on those. As far as the total number of teleconsultations are concerned, till date we have clocked over 43,000 teleconsultations, and well over 20,000 patients have been covered through these teleconsultations, and an average response time of around 1.5 days has been observed in these consultations. And typically telemedicine consultations, those have been outlined here, they have been instrumental in saving a lot of money as far as patients are concerned, and they've also saved a lot of time and added to the convenience of the patients, because they need not they would not have to travel to the experts end, and as a result they've been not only considerable savings in time and money, but also the quality of healthcare services. Those have been made available to these patients in their smaller cities or rural areas. They've been really world class. And we have also developed a suite of medical M-Health apps. There are around over 20 M-Health apps which have been developed, and they are available for the people to use here. And things like hospital search, BP monitor, or nutrition facts, medicine monitor, and BMI calculator, etc. These small but very useful apps have been developed, and these are being used by people at large. Next. Besides the R&D or the development of healthcare IT products, CDAC Mohali, we are also into running specialized training programs in the domain of healthcare informatics or telemedicine as well. And in these programs, these programs are primarily conducted for the international audience, wherein the programs of Ministry of External Affairs are offered to the people in around 160 countries. And every year CDAC runs 3 to 4 such trainings, wherein the members who have worked on the development of various technologies we've just discussed, they run these programs and they act as the faculty members. And some of the programs are listed here. We've been running training programs on healthcare technology management and clinical engineering, then biomedical equipment and medical informatics. We've also run programs on the telemedicine and e-health and various aspects of medical equipment as well. And these trainings have been imparted to people from over 50 countries, and they are more than around 2,000 in number, because every year we are training over 150 members from these countries. So that is all that we have in the training aspects. And as far as research is concerned, we are collaborating with various agencies overseas. We are in close contact with agencies in the US, with research organizations and the health ministries in Taiwan, and of late we are also establishing links with the popular university in Africa, and that is Makerere University. And we are working on various research aspects, especially for the Auburn and or the American universities. We've designed certain case studies which are being very popularly used in their management programs. And we've also presented a couple of research outcomes based on the collaborative effort that was carried out here in India. And the teams from these universities was here with us, and we worked together to write research and share our experiences. As far as Taiwan is concerned, we are in close contact with Taiwanese government as well as the Taipei Medical University, because they are using a lot of artificial intelligence tools. We are trying to interact with them and are working on a project to design something which can carry this personal health records management system to the next level, wherein we would have some sort of artificial intelligence embedded into it, and would use predictive analytics and tools like those to ensure that PHRMS is just not about saving or storing or archiving health records, but it would add a lot of value to the users by raising alerts or by showing up notifications, etc., all based on the algorithms and the models. Those we'll design along with Taipei Medical University, because they've been into this domain and they're already practicing these predictive analytics. And for Makerere University, we have helped them to design the health informatics program for them, we've been their reviewers. We've helped them to launch health informatics program in the Makerere University, and we are also working to carry this program further and also initiate some sort of a collaborative project along with them. Besides this, there are a couple of other countries in Africa especially, wherein we are teaming up with them, and we are offering their researchers to come to DAC Mohali and work with us, learn from our experiences and share their aspects, that what are the types of challenges they are facing in terms of development of technology, in terms of the usage of technology and the expectations of the users in various hospitals and various clinics. So finally, our efforts, which span more than a decade and a half, we've been able to draw some recognitions in various events, and those have been those are listed here in this slide. We've participated and won various awards for mHealth initiatives, for telemedicine implementations, and now we are working further towards presenting to the country the personal health records management system at the national level. So thank you very much, sir.